of over 100,000 people at least.
I'm wondering, though, whether the economic incentive is so great that they're going to deny everything that they can. And once this thing is built, if it gets built, then it makes it much more difficult to close.
It does.
Absolutely.
And at some point, we have to ask ourselves, when do our local officials start to value our families, our money, our health more than these financial incentives that they're looking at? Because the problem is, Nick, when they're looking at these financial incentives, they're not looking at the other side of that coin. Mm-hmm. And what are the financial costs to the public? What are the costs for increased learning disabled children in schools? Do you realize that from 1990 to 2000, learning disabilities in Montgomery County increased by 94%, more than double the state learning disabilities increases.
For the same time.
For the same time.
Right.
Autism increased in Montgomery County 310%, which is astronomical. Right. And if you look at now, there's just been a new study linking autism with air pollution. You know, childhood cancer rates in Montgomery County went up 71% since the mid-'80s to the late '90s. 71% it increased, while in Berks County and Chester County they went down, and in the state and the nation. Something's wrong. So that was childhood cancer deaths that I'm talking about. You know, the signs are everywhere, and when we're talking about our children and we're talking about their future and what can happen, I mean, it's really awful, because even elevated infant mortality, it is really a problem here. And that has been linked with air pollution. There's studies that link elevated infant mortality with air pollution and miscarriages and so forth and so on. So the evidence and research documented is there. All people have to look, and if people don't believe us, if they're out in the audience and say, oh, this is horrific, how can we believe it's so bad? We didn't believe it was that bad. We even, when we got some of this data together, we had people go back and look at it for a second time because it sounded so awful to us. But the sources that where it comes from, the Pennsylvania Cancer Registry, from state data on these other elevated infant mortality and so forth and so on, and the learning disabilities, we have websites it comes from. If people, we welcome people to come to our office, to talk to us, to pick up packets. We've put packets together on individual issues about this trash-to-ethanol plant, what it means in terms of air pollution, water contamination, the cost to the public. That's what we started out with. For learning disabled classes, for example, across the street from the landfill, from the late 80s, when Pottstown landfill only had one combustion source, there was one learning disabled class. That school right across from the landfill. By the time of the late 90s, there were 7. Our learning disabilities going up everywhere, sure. But what does it cost for birth defects or other problems where you have to hire one-on-one people to go around with children in schools? Those are some of the real cost of this. And what does it cost for more and more of our residents to have to go on disability? We had a guy tell us in Montgomery County that there were more people around here. He has never seen so many young people on disability anywhere that he's ever lived or been. He works
and there's a reason for it, and we also know with
Right.
the increase of these facilities and increase in air pollution, water pollution, and land pollution, that whether it's a direct correlation or not, something's going on.
Right.
And environment, I mean, it's like you said earlier, we don't pick and choose the air that we breathe.
Right.
It is there, and we breathe whatever's in the air.
We can choose to smoke, not smoke.
Right.
We can choose to eat bad food, eat good food.
Right.
Those are choices, life choices we can make. But when they put poisons in our air, we cannot avoid them. And our children who are out playing and playing sports and doing all those things are the most impacted, not only because these are a greater impact to their cells that are reproducing faster, but also because they're outside more.
Well, that the DEP uses a standard that uses adults as the standard for these things. That in itself is a travesty.
That's right.
I mean, they should be
true.
using the weakest or the
most
most
protected,
vulnerable in our society as the ones
EPA's
right.
own March 2003 study showed that these kinds of chemicals that are put into our air, that fetuses and children under 3 can be 10 times more vulnerable than the standards that are based on adults. And children 3 to 15 can be 3 times more vulnerable. When we know this, why would we allow such polluting facilities as this? And go ahead, the studies.
Yeah, I want to follow that up because we've compiled a lot of information, Nick, and we're certainly willing to share this with anyone that's interested in looking at the facts. We hope that includes Limerick supervisors. We hope they're willing to look at some facts. But children and air pollution, which is obviously one of our serious concerns. I mean, this graphic right here on the set, we're concerned about children. We're concerned about fetuses. I mean, children are being born with multiple toxics in their bloodstreams the very first breath they take in this life. That's somewhere between irresponsible and criminal, according to a lot of people in our society. But just listen to the sources that we've verified that have said children and air pollution don't mix real well. We're talking about lots of releases by the Associated Press as recently as this month. We're talking about the University of Massachusetts Lowell study on childhood cancer and combustion byproducts. California Health Department suggesting that autism has a relationship to hazardous air pollution. HAPS, we've talked about that in previous programs, which would be an issue if this facility goes up.
As a matter of fact, there's evidence that proves that HAPS are a major part of the air pollution from corn ethanol plants.
Correct. That's correct. Let me continue the list because we're not finished yet, Nick. The Policy Committee on Environmental Health for Pediatrics magazine, air pollution and health hazards. So the medical community, medical professionals, including physicians for social responsibility, just keep piling up all this evidence. I don't know about you, but I would have a tendency to believe the medical experts compared to some mid-level administrative employee at an agency like DEP relative to the effects of air pollution on children's health. Profiles on environmental health, another communication. Air pollution 6 times greater for children. Precisely what you just said. We need to think about the most vulnerable people in our society. Fetal deaths climbing with air pollution. Science News. I mean, these are peer-reviewed journals, including articles written by some of the top professionals in the country. BBC News. This is not unique just to this country. We're not the only people who are looking at these things, but the BBC News Online reported that poor air harms lungs of unborn children based on information in Europe. The Journal of American Medical Association, asthma prevention may be the only cure. That's just for the children's side of the ledger.
And these toxic pollutants really do, when a woman is pregnant, they get into her body and they cross over into the fetus. There is they can't even deny that anymore. So the other thing is the Physicians for Social Responsibility have a broad body of evidence that connects the learning disabilities with the the kinds of things but reduced IQ, ADD, ADHD, all these things are linked with toxic exposure.
Well, if pollution is not the cause, then I have to ask the question, what is the cause?
There are lots of things that cause cancer and cause all these other problems, but the whole point is genetics loads the gun and the environment pulls the trigger.
That's what I'm saying.
That's the real issue.
No genetics exists outside of an environment.
That's right.
So if the environment's polluted,
it's only where it attacks you. Right. That's what your genetics.
Right.
And conversely, Nick, as you've just suggested for our viewers, if the environment is not polluted or less polluted, there are fewer bullets in the chambers to be fired.
Right.
So reducing or eliminating avoidable chemical exposures, poisons in the air, will definitely help reduce the threats and the risks. And I know Donna wants to talk about zoning, because zoning is very often the gateway to disaster in a lot of places. And
this is what we see as a real deceptive thing, Nick. Limerick supervisors had an ad in the paper in the classified January 4th about their rezoning. It's this long. I mean,
it's 2 pages. It's like that's the legal news.
The things that really spoke out to me were the fact that you could they could do something about the health, but nowhere in this whole thing is there anything about public health. Nowhere.
As this is written, Nick, this is very polluter friendly, but it does not address in any way, shape, or form public health or safety, nor does it in any way protect the the residents.
So they don't
of
raise
Limerick
the
Township.
issue of public
Not
health
at
at
all.
all with
Not
that.
in there.
With that.
That's not in
Nowhere.
there.
It's nowhere
As a
in
matter
there.
of fact, they do make comments under one section. Buzz needs to read for you real quick.
About unforeseeable impacts?
Right.
Yeah, basically, this notice and this proposed zoning change
This shows you how absurd this
suggests
is.
that the concept of a private facility is entirely new. Not exactly. The exact manner in which this industry will develop is unknown. Well, not exactly. I mean, there are some unanswered questions, but there's a ton of evidence.
Well, we don't really know.
We don't know everything, but what we know is bad.
The point is they're prepared to allow all this.
Right.
Knowing this.
Knowing this.
As an experiment,
As an
basically.
experiment.
Right.
As an experiment.
That's the point. And that's the real point. They're prepared to do all that. And the other thing is, another thing, if I lived near there, I'd be so irate. They're allowing high noise levels between 7 in the morning and 10 at night. What happens when you want to put your kids to bed at 8 o'clock at night?
24,
They're just
yeah.
the people that live close to it. And that doesn't just mean in Limerick either.
High levels, 24 hours a day, 7 days a week. But
Can you imagine living around that with the odors?
high levels during those hours that Donna just mentioned. If the odors weren't bad enough, if the threat to your health wasn't bad enough, the noise and the traffic wasn't bad enough, and the potential to lose property value wasn't enough. If I'm a Limerick resident, I'm either on the blog, or I'm on the telephone to Ace or to somebody at the township saying, you guys really need to do some due diligence here. What you've sold us so far makes no sense.
You have to take things like, we're going to allow the township to bear the burden of this and not know what we're letting the township bear the burden for. That is ridiculous. I can't even imagine. But anyway, the real issue is, Nick, people don't realize that this rezoning has everything to do about their health and their safety, because nowhere is it said in there. Because people say to me, oh, it's just about zoning. But it's not just about zoning, because once the zoning goes through, there'll be no way for people, because then the Limerick supervisors will use this as an excuse and say, well, we can't do anything about it because our zoning provides for it, which is the same sort of attitude they had about those casks.
We just have about a minute or so. Any wrap-up thoughts? I don't know what we could add to what you guys have said tonight, because it's been really powerful, really.
It's time for anybody within our viewing audience who cares about this or believes that they have a responsibility to protect 100,000 people to contact ACE, to contact Limerick Township and say, you have to find something better than this. This is lose-lose for every resident in this region. A very small handful of people are going to win something. And what's been promised historically hasn't been delivered. So take another look at this.
Donna, any other thoughts before we let you go?
Just to please call us and add your name to a list of people who really oppose this trash-to-ethanol plant in Limerick.
Thank you. Folks, you've been watching the ACE report tonight. There's not much I can say to this. I was thinking about the name Limerick and what it evokes when you hear that name. It evokes kind of like an idyllic, peaceful, pristine area that people would live in. And it seems like that's not the direction that the supervisors are tending to take. So be proactive, take care of yourself, show up at meetings, read about this, contact ACE, do all the things that you need to do, because it's your health that's here. It's not only your health, it's the health of your children and their children, perhaps. Thanks for tuning in tonight. This is Nick Lawrence. We'll see you the next time right here on the ACE Report.